Today we are going to a new topics, and before going to, I would like to say respected chief guest, though he is absent here, and in exchange of this, we are respected to another person, learning audience, my beloved student, Assalamu alaikum. And you know today's topics is varicose vein. Though it is not directly my subjects, but I am very much interested and I feel proud to learn it and at the same time to treat it my patients. And all our patients are highly satisfied to treat it from me. So, first of all, the varicose vein, I will mention a quotation that is a never-ending program or problems if mistreated. And today's learning objectives are introduction, etiology, clinical presentation, treatment approaches, advanced technologies, complications, as well as management of our settings. And now the introduction. What is this varicose vein? All are you know about this, but though you are know what is the IC, we can define is like this way. It is a dilated, elongated, tortuous and palpable superficial veins as a result of venous hypertension. If you follow these pictures, here all of the criteria of the veins, that is dilated, tortuous and elongated, both are present. And common sites you all are know, and common sites are especially the lower limbs, that is superficial veins, sometimes the upper limbs, as well as other parts of the body like hemorrhoidal veins, in esophagus, esophageal vein, and in the scrotum, that is pampiniform plexus of veins, that is varicocele. And surgical anatomy. Venous systems of the legs are comprises superficial veins, deep veins and perforating veins. And venous system of the lower limbs are this. If you follow this diagram, here is showing the superficial veins, this is, and this is deep veins, and these are the perforating veins. And this is the muscles, and within the muscles, that is valveless vein. Superficial veins lies superficially, and these are connected with the deep veins through the perforating veins. And normally, the superficial veins drainage to the deep veins through the perforating veins. Superficial venous system, that is comprises long and short saphenous vein and their tributaries. These systems are low pressure veins. Middle cord is thicker and usually consists of circular muscles, and in long saphenous vein there are about 12 or more valve is present. And this is the perforator systems. By this time I showing the pictures, and this is another pictures. If you see here, this is one of the veins, is another veins, and within this muscle cord, and these are connected by the perforating veins or perforator veins, and valves are usually this. And the direction of the valves, you know, from distal to proximal, that is towards the heart. Deep venous system, these are the accompanies with the main arteries supported by powerful muscles and high pressure system. And now etiology. Etiology, that is congenital or idiopathic, or some say that is familial predisposition. This does not involve deep veins. The secondary, then that is trauma, obstruction due to inflammations, or only single inflammations like hemorrhoids, esophageal varices, varicocele, which I mentioned previous time. And if you see this, that is varicose veins risk factors, that is firstly I show here that is genetic predispositions. The person who have the genetic predispositions, normally it should be hereditary, go through one generation to another generations. And here this is use of some drugs, especially oral contraceptive pills. And this is female person are more sufferers. Prolonged sitting posture is one of the causes, that is risk factors. So you cannot sit long time, you should be always avoid it. Prolonged standing is another causes, and in older ages another causes, and pregnancy, obesity, and finally the smoking. What happens if varicosity is happened, the normal veins and this. Now the pathophysiology, how varicose vein develops. Any risk factors or causes increased venous pressure, dilation of the veins, valves are stressed, incompetent of the valve, reverse blood flow, calf muscle fail to pump, and venous distension. Reverse blood flow, that means normally the veins blood flow from distal to proximal, that is towards the heart, and it is guarded by the valve. And I mention here, this is the normal picture, these valves are blood towards the heart, and pumping of the muscles or contraction of the muscles, blood flow from distal to proximal. When due to any causes this backflow may be happen, that is not from distal to proximal, that is proximal to distal. And now a clinical presentation of these patients, how the patients present to you. If we see these pictures, that is patient have tingling sense, swelling of the limbs, pain, heaviness of the limbs, itching may present, some patients cramps, burning sensation may present. And other presentation may present patient also like spider vein, venous ulcer, especially around the ankle, and sometimes reticular veins. What are the signs we usually present this type of varicose vein patients? If you see on an inspection that is visible, tortuous, dilated, subcutaneous vein are present, pigmentation may present, ulceration, and chronic dermatitis or eczema. On palpation, we can get tenderness, pitting edema, and thrill. And on auscultation, usually bruit may present. The clinical signs are tapping test, Trendelenburg test, calf impulse test, Perthes test. I do not mention here details. Those who are more interested, you can follow the books. And investigations. What investigation we can done this type of diseases? Usually, very simple investigation we can diagnosis, but the clinical diagnosis is more important than the investigations. Just on inspection you can diagnose it, but the which venous systems or which veins may involved, additional need we investigations, and several investigations we can perform. The most popular investigation which are done everywhere, that is duplex ultrasound scanning, and this way we can perform it. Occasionally, trans-abdominal or transvaginal duplex scan may require venography. This is more in specific, but some have disadvantages. Intravenous ultrasound and varicogram, that means for varicocele. Management modalities are conservative or palliative treatments, minimal invasive, surgical intervention. Within the conservative management, what are the indications? Why we go for conservative treatments and which patients are selected for conservative patients? Number one, aged patients. Because of the surgery are failed hair and recurrence rate is more, so we don't perform the surgery in aged varicose vein patient. Pregnancy or puerperium, one of the indications, because of this is the temporary varicose vein, but after recovery, usually that is delivery, the varicose vein is improved. Patient refuse or unfit for operation, and if the pelvic tumor is present, if these have present, we are usually go for the conservative treatment. What are the conservative managements? Conservative managements are elevation of the legs, avoid prolonged sitting and standing, compression of the stockings, exercise and weight reductions. But the conservative treatment is not suitable for long time management because of patient cumbersome situation may arises if you long time this conservative treatment continue. And the compression stroke is most popular. It will get in the two way, because below knee and above knee. Can varicose vein be treated with medications? The studies say efficacy is not proven, or oral or topical medications, but we clinician, we are popularly uses the drugs, and among them one of the drugs is Daphlon. Not only in our country we are uses, but worldwide it is uses. Now the minimal invasive methods, this is now the most popular. Every patients are going to know, without surgery you perform everything for me, without cutting. Within this endothermal ablation, within the endothermal ablation, one is most popular, that is endovenous laser ablation, that is laser therapy in a single sentence. Number two is radio frequency ablation, and another method is non-endothermal, non-tumescent ablation, that is sclerotherapy. Endothermal and non-tumescent have some disadvantages, so to avoid this disadvantage, they are like nowadays sclerotherapy, one of the options. Now the most popular worldwide and also our country, that is endovenous laser ablation. This is the very simple procedures. We are showing by this time the picture, 3 pictures. That is a small glass fiber is inserted into the vein. A ultrasound aids is positioning of the fiber tip, that is, and here light is focusing to identifying the veins, and finally the laser energy is transmitted and gradually withdraw it. When effective or laser therapy is ending, then gradually withdraw it, and the vein are usually collapsed or shrinkage due to temperature. And what are the advantages of these procedures? That is laser therapy. No postoperative scar, done with local anesthesia, no need general anesthesia or spinal anesthesia, and recurrence rate is very low, that is only 3%, but have some disadvantage, that is very costly, high technical skills are required, skin burn may happen, cannot perform everywhere. And another is the radio frequency ablation. This is the most popular device because of we can closer fast. We can this way we can perform. I cannot elaborate it here. And mechanism how radio frequency ablation is worked. Positioning the catheter into the vein, which is showing here these pictures, and the catheter delivers heat. And the vein wall shrinkage and collapse. All the laser or radio frequency ablation all have due to temperatures. Ultimately, the veins are shrinkage and collapsed. And radio frequency ablation have some advantages and disadvantages. The advantages are quicker procedures, cheaper, hospital admission not required. It should be performed as a day case surgery. And disadvantages are may happen nerve injury, skin burns, and may happen the paresthesia. Limitation of the endothermal ablations are treats only junctional and truncal incompetency. How to overcome we can it? Concomitantly by either phlebectomy or sclerotherapy. That means endothermal procedures needs always or invited to the other procedures like phlebectomy or sclerotherapy. No non-endothermal, non-tomescent ablation, that is sclerotherapy. Indications are recurrent after operations, below knee varicosities, troublesome varicosity alternate to surgery. That means where normally we faces the problems, in that places the sclerotherapy is good. How sclerotherapy should be done? That is sclerosing agents, sodium tetra dicycle sulfate usually injected like a syringe through the cannula. Ultrasound guided foam sclerotherapy, and this is the procedures we can perform it very simply, but materials is need available everywhere. Catheter directed sclerotherapy. How here we showing that how the previous picture acting or elaborately we showing here. And catheter directed sclerotherapy another we are showing here machine and others. Now the advantages and disadvantages of sclerotherapy, that is sclerotherapy is cheap and simple method. OPD procedures can be repeated, that is if you one time fail you can again applying. No anesthesia required, but laser and others need anesthesia, that is local anesthesia or other anesthesia like spinal or GA. Disadvantages are skin necrosis or abscess may formation, anaphylaxis or vasovagal shock may happen. Recent advances the management of varicose veins. After laser, again the world say another procedures, that is mechanico-chemical ablation. that is latest we are applying it or not applying it. Endovenous glue or cyanoacrylate embolization, that is glue therapy only. Mechanochemical ablation or glue therapy, that is latest version, and it is applying this way. If we see this picture and this picture, that is through the catheter or vein we are applying it, then the glue materials are scattering this way from one of the tip of the catheters, and finally they are working and usually collapse. Endovenous glue, a treatment catheter placed within the vein. A handle is used to infiltrate the cyano, that is glue. Now the surgical intervention, and this is our main performing works which we done here in our hospital also, that is open surgery or adjunctive surgical technique. Indication of the surgery, that is symptoms refractory to the conservative treatment, that is failure of the conservative treatments with complications like patient had varicose veins with pigmentation or chronic dermatitis or ulceration. Large varicosity is subjected to trauma. As a result of trauma, large varicosities may present. Cosmetic concern, patient wanted. So the open surgery is several choice or several option or several methods. The first method is only ligation, that is ligation of the veins combinedly here, that is ligation and retrograde injection of the sclerosing agent. Multiple avulsion and excision of the convoluted veins. This is our choice of treatment in this prospects, and I frequently done here this method, multiple avulsion or excision the convoluted veins. And another methods, that is Coquet and Dodd operations. This is, though it is the very old, and it is usually done for the perforator veins. Now the surgical ligation and strippings. The principles are fully dissect the point of junctional incompetency, remove the refluxing axial vein and dilated tribotis. Anesthesia we like usually regional anesthesia, not GA nowadays, that is epidural or spinal anesthesia. Trendelenburg's procedures or operations. This is the old method. Juxtafemoral flash ligation, that is near to the saphenofemoral junction, we dissected it and identifying and ligation done, that is Trendelenburg procedure. Why combine stripping or of long saphenous vein for treatments? Done alone there is high chance of recurrence. So among the all procedures, if you singly done, the recurrence rate is very high, but if you done combinedly, that is recurrence rate is very low. And here is showing the picture, that is perforating vein markings and after operations. Adjunctive surgical intervention, and it includes phlebectomy, perforator ligations. These two are the mostly popular along with surgery. And phlebectomy, this we are not details say here. Perforator ligations, this is the same as our procedures. I mentioned later here, and this is one of the ligation, that is treatment of surgical procedure of the perforated veins. Vein is very small, you cannot see by your eye, but instrument is very large. Complications of surgery. What complication you can face from your surgery? First of all, bruising, pain, numbness due to involvements of the nerves, and infection. Nerve injury, usually not involved, but if involved, that is most dangerous. Thrombophlebitis, deep vein thrombosis, and finally the recurrence again. Now the contraindications where we cannot perform the surgery. The most common contraindications are firstly pregnancy. You get a patient and think that needs surgery, I will go for the surgery. This is absolutely wrong idea. Number two, women taking contraceptive pills. So the female, you should must ask about that contraceptive pills. Deep vein thrombosis with edema of the limbs. If any patient came to you with deep vein thrombosis with edema, you cannot perform that. And finally, thrombophlebitis. Complications if are not treated, that is normal complication of the varicose vein. First complication is hemorrhage, venous eczema, that is chronic dermatitis, venous pigmentation, thrombophlebitis, periostitis. So veins are present superficially, how periostitis may happen. Lipodermatosclerosis, ankle joint ankylosis, deep vein thrombosis, venous ulceration, and finally calcifications. So this all may happen if you are not treated the varicose vein. Now our case, and the case is Abdul Hussain, 52 years, male patient, Muslim, occupation is day labor from Madaripur. His complaint is prominent veins in the left leg for last 2 years, swelling and itching in the left leg for 1 year. So varicosities firstly started, and swelling and chronic dermatitis is late appears. The past history patient have hypertensive, chain smoker, no family history of varicose veins. And our clinical diagnosis is varicose veins of the left leg, including ankle and lower part of the thigh. And if you see here, the patient have also dry skin, that is dermatitis, and this patient have also itching is also present. We can perform the investigations, only single investigation, that is duplex scanning, but other investigation we are performing for operations after counseling our patients. And the surgical treatment here we done, that is ligation and excision of the varicose vein. And this is the preoperative scenario we are showing here, on standing, on sitting, and finally at the on lying, and all have pictures at your hospitals. And now we are ready to surgery in my operation theatre, that is Basundhara Ardern Medical College. and my assistant is holding the leg, and I am ready to showing myself and also my patients as a pic, though it is not a good hair, but scenario is very good behind scenario. And finally we just give incisions. It should be like jumping from outside inside to outside, like that situation, and we are seeing that veins are identifying, and more close to pictures, that is we are ready for excised vein by scissor. My hand is scissors, my assistant is identifying, and one assistant is retracted it, and another places again with same way identifying and ready for cut it and excised it. And this is one of the pictures here. If you see that the varicose vein is showing the like a balloon, the single places, and this is the more prominent ballooning like a gravid uterus, and just medial to the knee. And if you see this another way, another view, it's look like this. And after rupturing of the balloon, we are extended it and cut, it's look like this. And this is all are at surgical field, that is how we excised the veins and how we cut. Sometimes we cut from a small distance, then the vein is excised by dissection. And this is one of the pictures I showing for the students, especially here the veins wall is like this, how much dilated it. And on the right side, all the excised veins are now collapsed as like kismis. After excision, we have the multiple incision here. The incision marks I am showing, that cut is very minimal. If you done it by endoscopically, I think that this is more than cut, this picture. And now we are going to closes the wound one after one. And after closing, not skin closing, just subdermal closing, if you patent it or if you keep it like this way, it will be healed. And this is my team. If you see, my team is renowned surgeon are present, my assistant surgeon, that is Dr. Atul, my anesthesia, as well as my intern doctors, all are helpful to me to perform it at our operation theatres. And we plastering the patients for immobilizations. And this is the postoperative follow-up started our patients. And these pictures at the 14th day, no sorry, not 14th day, 3rd or 4th POD, we have removed the bandage, and this is the scenario of that time at our emergency, and this is also. And on standing we see this, there is no varicosities is present. On second POD, on that day also we are on standing patient walking this way. And after removal of the plaster, we applying this, which are showing here, that is stockings. This is above knee. You says where varicosities vein is present, that is short saphenous vein, that is below knee stockings, and long saphenous vein, that is above knee stockings. And this is everywhere uses after any surgery. And this is follow up at the 6th weeks, that is 42 days. And if we see here in two view, that is one of the view, there is only scar marks presents, there is no varicosities from distal to proximal. And also if you see here, that is dermatitis is also reduces. So for my knowledge, it will around 3 months is required to get a normal skin. And on the right side, the most prominent varicosities like the graviductus or balloon hair is present, and also hair another, and these are the smalls. And finally, we are, if we seeing this, that is preoperative state, what we get the patients in which way, this is, and just after postoperatively this is, and or the just after operations, and at 6 weeks. So take home message from these operations and many of the latest version of the procedures of the operations. Do not forget the older methods, sometimes those are more effective. And finally, this is the pictures. Thank you for patient hearing. Any questions?
তো হরমোনাল প্রিপারেশনগুলো ইউজ করার কারণে কন্ট্রাইন্ডিকেশন কেন হবে? এটা তো টেম্পোরারি, আমরা হরমোন প্রিপারেশন ওসিপি বন্ধ করে দিলেই তো এটা সে মানে অপারেশনের জন্য ফিট হচ্ছে, সেক্ষেত্রে এটা কন্ট্রাইন্ডিকেশন কেন হবে? আর কী কী হরমোনাল প্রিপারেশন অ্যাগ্রাভেট করে ভেরিকোজ ভেইনের জন্য? আর স্পেশালি আরেকটা জিনিস আমার কাছে মানে একটু কনফিউজ, যে এই রোগীটা এই বয়সে ভেরিকোজ ভেইন অপারেশন করার মানে লজিক্যাল ইন্ডিকেশনটা কী ছিল? মানে আমি তো দেখলাম সে অনেক বার্ধক্যে আছে, তার মানে ওই রকম সিভিয়ার কোনো কমপ্লিকেশন মনে হচ্ছে না, যেহেতু কসমেটিক একটা ইস্যু দেখলাম। তো সেক্ষেত্রে সে কেন একটা প্রসিডিউরের জন্য অপারেশনের জন্য এই রোগীটা মানে সিলেকশন করা হলো? এটা আমার মানে
Thank you. I started your answers from number 2 questions. We are showing here that varicose vein have some complication always arises, and the indication is, one of the indication is if complication may present. I am showing here the your subject, that is chronic dermatitis, is present for these patients. So this is one of the main indication to perform the surgery. If it is not done surgery or treatment, it will be may arises other complications like ulcerations or others. The number one question is what are the hormones and how they are effective or may happen the varicosities. A lot of hormones are usually acting, usually the progesterone and relaxin, these two hormones, and also we are showing here the oral contraceptive pills, and all are have different way action. The progesterone usually or relaxin, these two hormones are usually acts all of the tissue of the body, and their main works is dilated hair, dilated the veins. If dilation of the vein for a long time happen, the valves are incompetent, that valves are normally acts. So incompetent valves is one of the causes to develop the varicosities, and contraceptive pills works as a also directly to the valves, that is here say that is incompetent way, that is dilation of the wall, and finally incompetent to the valves. Thank you.
স্যার দেখা যায় যে ইয়ং পেশেন্টরা যদি আমাদের কাছে আসে সেক্ষেত্রে তাদেরকে আমরা কিভাবে কাউন্সেলিং করব যে এই ভেরিকোজ ভেনটা আপনি কতদিনের মধ্যে, বা আমি তাদেরকে কিভাবে বোঝাবো যে আপনার এই সময়ের মধ্যে আপনার এটা অপারেশন করা উচিত, বা সে যদি ইয়ং পেশেন্টের অপারেশনও করে, অপারেশন করার পরে সে যেই কাজটা করতো লো সোশিও ইকোনমিক্যাল কন্ডিশন যদি সে সার থাকে, তাহলে কি স্যার সেটা কি আবার রিকারেন্সি হতে পারে কিনা, বা সে ওই ওয়ার্কটা আবার করতে পারবে কিনা, বা স্যার তার হচ্ছে যে এটার মানে রিকারেন্সি হওয়ার তো একটা চান্স থাকে, বা সে কোন সময় বুঝবে যে এটা অপারেশন করতে হবে, বা আমি তাকে কিভাবে স্যার এটা বোঝাবো যে এটা অপারেশন এখন করা উচিত?
Thank you for your good questions. I am by this time showing here the indication of the surgery, that varicose vein along with complications, this is one of the good patients to select for surgery. I am showing here there is many complications like ulceration, dermatitis, itching and pigmentations, all have any present with varicosities. That is the ideal case or ideal time for surgery. This is the another, and if the patient wants, one of the indications, you can done surgery. The first man asked the why this patient is done surgery. This patient have many indications. Older age is not single indications to contraindications, because cosmetically is very ugly. Ulceration, not only hair ulceration, that is pigmentations and dermatitis, itching, all have present hairs. Your normal cases, how counseling this? You counseling this way, if you chronically persist, it will be happen, there is several side effects or complication may arises. If any risk factors, it should be avoided or it should be corrected. Or after operation, the question is yours. If the heavy workers, if your idea is to change the professions, and before that you are counseled it. Thank you.
So you have mentioned that one of the complications is periostitis. Would you explain, sir, how it relates with varicose vein in superficial vein connects with the periostitis? Thank you, sir.
Periostitis may happen in very simply. Sometimes many bones are directly contact with superficial veins, as for example the great saphenous vein like the tibia. If it is ulcerated, that is ruptured, or ulcerated may skin happen first time. From here, that is blood is invaginated to the tissue, surrounding tissue, and RBC is breakdown, hemocyanin is present, and it irritated the periosteums. At the same time, the color is also changes, that is pigmented. In this way, the periostitis may happen. Thank you. Student have any questions? Student a question করেন? Anyone?
এখন আমার একটা আর কি রিলেভেন্ট কোশ্চেন ছিল ট্রিটমেন্ট পারপাসে, যে আমরা যদি এন্ডোস্কোপিক সার্জারি দিকে যাই সেক্ষেত্রে রিকারেন্স রেটটা বলতে অনেক হাই, আর হচ্ছে ইউজুয়াল হচ্ছে ওল্ডার মেথড যেটা, সেটাতে আমরা সার্জারি করলে রিকারেন্স রেট কম। কিন্তু স্যার কস্ট ইফেক্টিভ দিক থেকে বাংলাদেশে যারা বেশিরভাগ ক্ষেত্রে মানুষ যারা লেবার বা হচ্ছে হার্ড ওয়ার্ক করে বা সব মানে ভারী জিনিসপত্র ইয়া করে, তাদের ক্ষেত্রে ভেরিকোজ ভেনটা হওয়ার চান্স বেশি। তো এখন এখানে কস্ট ব্যাপারটা অনেক ম্যাটার করে আর কি। সেক্ষেত্রে আমাদের কোন জায়গায় গেলে আমরা পেশেন্টকে কিভাবে কাউন্সেলিং করব যে আপনারা এই দিকে গেলে ভালো হয়?
Thank you for your good and practical questions. I am facing with these patients this type of problems. So I am showing here there are several methods. One of them which is available in our country and few centers like Ibn Sina United maybe, or also Evercare hospitals, not others. That is laser, endodermal laser ablation therapy in a single word, Bardem also. And if Bardem you say I am getting a patient, how much quantity taka is required for this great saphenous vein? 3 lakh. 2 settings 3 lakh. Ibn Sina 2 settings about 2 lakh. You imagine it? But my patient is the so poor, only 20,000 taka given here total, and among them 10,000 taka we are within the hospital pocket, and 10,000 taka 5 or 6,000 taka for drugs, and around 4,000 taka for seed rent. So you can imagine it, in the whole world any surgery within 20,000 taka you complete everything. I am still now nothing money, but for you, for the patients, I do it. So far difference. If you have the capability, you have lot of money, you can go everywhere. But you cannot counseling to your patient this type. You can go there and there. But nowadays it is one of the problems. Everyone gets to number 1. So number 2 cause works, you can get benefit everywhere. Yes, the surgery, in this surgery recurrence rate also high than the previous, that is laser therapy. But if recurrence again I perform surgery, I have no problem, patients have no problems, again only needs 20,000 taka. So always think practical view, where you stay, where you learn, in which way you are performing. This is the main issue to service our country as well as the South Asian country. Thank you.
Dr. Ghulam Rahman Dulal sir for his nice presentation on a unique topics. I would like to supplement something, sir.
Yes.
Instead of question. First of all, few questions has come up regarding the indications. Actually, according to books and literatures, there are some absolute indications, there are some relative indications. And with that we have to take the situation also, circumstances also, from where the patients come, what is the ability, what is the profession of the patients. Because if it's a she and she is an actor, a slight impairment is a big thing. Even after the surgery, if there is a scar, that might be a big thing. But for most of us, perhaps that's not an important factor. So for regarding indication and about indications, the patient's choice is also important. What the patient is asking, and important thing that we have to inform the patients that these are the indications. Here is your conditions is like that. You might do it. If there is absolute indication, you have to do it. Whether you will do it or not, it's up to the patient. But if there is relative indications, then the choice, patient can make the choice. The autonomy of the patient can, in every situation, the patient will choose what to do in routine cases. And in emergency cases, the situation is a bit different. So totally on a different topics, I would like to add something. I think it would be nice if we get the 3D information before the CME programs. 3D means I'd like to say date, department, day. If we get the information, we are getting the information, but I think this will be nice if we get the information at the end of this session, when the next CME will take place. It need not to be done today, but the CME committee is here. In future, if it declared, because the next CME at least, not the 6 months or 1 year, So, and I would like to take this opportunity to another thing. I would like to ask Dr. Shiraj to stand up, please. Please come over.
I'm Dr. Muhammad Shiraj Islam, and I completed my MD in internal medicine and just newly appointed here as assistant professor. So thank you sir, and principal sir, and all of you.
As early you get the patient, treat early, so prevent it to get advanced, and advanced disease causes complication, and management will be more problematic. And the treatment is pressure stocking, even in early and even after post-operative. Whatever may be the procedure you've done to the patient, pressure stocking is a must. And last on, live healthy. When sir was showing the picture of risk factors, I was seeing that all this is in me. I am a special candidate for varicose vein, perfect match for varicose vein. So try to live healthy and advise your patient to live healthy. Thank you so much.
Thank you ma'am for your valuable comments. And now I am requesting Professor Dr. Nafisa Rashid ma'am to conclude our today's clinic session.
চমৎকার একটি প্রেজেন্টেশন আমরা দেখলাম এবং এটা খুবই কমন আমাদের আমরা আমাদের ফ্যামিলিতে বা আশেপাশে একটু খেয়াল করলে দেখব যে অনেকেরই আফটার
আমার তো মনে হয় কম বেশি সবারই আছে
মেল ফিমেল
ঠিকই বলছেন, সেজন্য তো সবাই আসতে বলছে যে সবাই বুঝে, অনেকে অনেক কিছু মনে করে সার্জারিটাকে কিংবা প্রসিডিউরটাকে
পরিশ্রম বা ওয়ার্কআউট একটু পরিশ্রম কম করে না, বাট তাদের হচ্ছে যাই হোক সেডেন্টারি লাইফস্টাইলটা একটু বেশি। আমি নিজেও দেখেছি যে আমার ফ্যামিলিতে বা ইয়াতে এই ধরনের পেশেন্ট আছে। আজকের পুরো প্রেজেন্টেশনটা আমি খুব মুগ্ধ হয়ে দেখেছি যে নতুন নতুন অনেক অপশন এসেছে, বাট পুরানোটা খুবই ভালো, খুবই পেশেন্ট কমপ্লেক্স খুব ভালো হয়, এটাও একটা অপশন। এবং তারেক স্যার যেটা বলেন যে এখন একটু পেশেন্ট চয়েস, পেশেন্ট যেটাকে চুজ করবে, আমরা অপশন বলবো, ইন্ডিকেশন বলবো, কমপ্লিকেশন বলবো, সবকিছু করবো, পেশেন্টেরও একটা ডিসিশনের ব্যাপার আছে। আর স্টকিং আমি দেখেছি এটা খুবই এফেক্টিভ যারা অল্প স্বল্প সমস্যাতে, প্লাস এখন শুনলাম যে মানে অপারেশনের পরেও এই স্টকিংটা খুব এফেক্টিভ। মোস্ট অফ অল আমাদের সবাইকে হেলদি লাইফ লিড করার চেষ্টা করতে হবে, পরিশ্রম করতে হবে, সুস্থ থাকতে হবে ইনশাআল্লাহ। থ্যাংক ইউ।